Oh gosh, when was that? Wow, March of 2001.
Wendy March says it's hard to believe her nursing career has spanned 25 years.
I became a nurse because I care about people.
The oath she took as a young graduate continuing to ring true today.
With loyalty, I will devote myself to the welfare of those committed to my care.
Do you feel like you still carry that pledge with you?
Oh, of course.
But March says the optimism she once had has been shaken by what she observes in some local nursing homes, where she picks up shifts as a registered nurse.
You see the deficits in staffing, you see the deficits in dietary and in health services. And I just feel like we really have lost our way, with the care of the elderly.
Back in April, she specifically remembers working an evening at what used to be called Wonder City in Hopewell, a 1 out of 5-star for-profit facility, according to federal data.
I saw a shoddy environment, a shoddy building, the overwhelming smell of urine, feces, people that were very unkempt, bad wounds. The dietary tray that came out for dinner was atrocious.
March tells me she was so troubled by the conditions that she never went back.
When I got in my car that evening, I didn't leave until around midnight because there was just so much to do. I was crying, Tyler. I'm sorry, we can't treat people like this.
Other staff at Wonder City had also raised concerns, according to a health inspection report. In April, some nurse aides who are responsible for daily care like feeding and toileting walked out on the job to protest chronic staffing issues. 2 of those employees, with a combined 61 years of experience there, said they were tired of having just 2 CNAs for 60 residents. Administrative staff reported that their requests to bring in more help when staffing was short were denied by corporate management, according to inspectors. A spokesperson for Wonder City did not return CBS 6's request for comment.
You go below a certain number of hours per day of staffing, you end up with more bed sores, more bladder infections, weight loss, and even increased numbers of death. Number one, I want to hear about any concerns you have, health concerns, if there's anything that I need to help you with today.
Because he had me on nothing. I was on nothing.
Okay. You had no atrial fibrillation before then?
Dr. Jim Wright, a long-term care physician and medical director at the nonprofit Lakewood Retirement Community, says a nursing home staffing level is the #1 indicator of its quality of care.
Are you seeing that most facilities are staffing their facilities up to what would be a safe minimum?
Oh, absolutely not. Absolutely not. I think the typical practice for Virginia nursing homes, especially the for-profit nursing homes, is to staff as low as possible.
But Melissa Green, a former facility operator, former health department regulator, and current industry consultant, has a different take.
I think a lot of them staff at adequate levels. Is there folks that staff at levels maybe not up to par? There may be.
Federal data shows Virginia nursing homes on average have one of the lowest staffing ratings in the country, 2.4 out of 5 stars. That's only above 4 other states. The score is based on facilities' amount of staff and rates of turnover. Virginia's long-term care ombudsman, Joni Latimer, says of the more than 5,000 complaints her office received in 2025, nearly 40% were tied to staffing-related issues.
We have still far too many situations where families and residents are encountering care that is not what it needs to be. It's not what they're expecting, and it's not what I believe that we agree to deliver when a provider accepts Medicaid and Medicare payments.
Staffing has also been a focus of concerns many residents and their families have shared with CBS 6 over the past 2 years.
There wasn't enough nurses there.
You could ring that call bell, and it might be an hour and a half, 2 hours before they come.
The ratio of nurses to residents, it needs to be done better.
CBS 6 reviewed health inspection reports for the 14 facilities that regulators cited for having insufficient staffing over the past year and a half. Every single one of them was a for-profit nursing home. The findings clearly documenting risks and harms to patients. Take, for example, Shalom Gardens in Henrico, where inspectors say no registered nurse was assigned to care for a resident the morning of August 14, 2025. She received no medications or assessments and was found unresponsive later that afternoon. Inspectors say staff pronounced her dead without performing any required life-saving measures. A senior administrator there tells me this incident was isolated and that licensed nursing staffing has been consistently at or above average. Across the state, from Staunton to Chesapeake, inspectors reported that inadequate staffing also left 39 residents neglected all night, some with untreated pain and no medication, may have contributed to an increase in residents acquiring wounds, had a profound impact on tracheostomy patients who died not receiving the proper care, led to a resident hitting and inappropriately touching other residents, resulted in a supervision failure that allowed a woman to consume her own feces, and caused a lack of showers and toileting care for residents. In her role as a regulator, Green says it was difficult for inspectors to even capture staffing-related deficiencies because there's no defined minimum staffing requirement on both the state and federal levels.
Well, if there's a complaint on staffing and then you go into the facility to try to correlate that with a deficient practice may be challenging.
What do you think about the fact that Virginia is in the minority of states without a staffing standard?
It's time for Virginia to get that in place, and I think it's a bottom line protection for all of the residents. And it seems, based on what we have observed, that without that clear standard, we're not ensuring that foundation for every resident that's in every nursing home.
It's a travesty. It's a travesty. I believe if we did focus on one thing to improve the care of our residents, if we simply focus on staffing and nothing else, we would see an improvement in quality throughout the entire state.
But Green believes individual facilities should set their staffing levels based on the needs of their patients. She adds operators are struggling with workforce challenges.
It's very hard for providers to find staffing, even with bonus and incentives, citing there are not a lot of folks that determine that they want to go into long-term care right out of nursing school when they graduate.
I feel we're not being heard, and I don't quite know if we actually have this nursing shortage everyone's talking about. I think what we have a shortage of is proper management and proper programs to deliver the care that we want to deliver.
During the 2026 legislative session, a proposal to implement a state staffing standard was reduced to a study of the topic. Lawmakers cited a lack of Medicaid funding, even as the budget adds a $70 million one-time increase to nursing facility Medicaid rates.
Due to her history of advanced CKD, she is not able to take anti-inflammatories, period. Hey, Dr. Wright here again. Good to see you.
Dr. Wright blames the inability for the Commonwealth to establish standards on industry lobbyists.
What the VHCA lobbyists for the for-profit industry have done is to create a perfect gold mine for out-of-state private equity groups to come in and make millions of dollars off of the back of poor elderly Virginians. While we do another useless study, how many hundreds or thousands of residents will die as a result of understaffing? We just have to remind ourselves that that's what we're choosing here. We're choosing a business model that hurts other people, and we're allowing it to continue year after year.
The Virginia Healthcare Association did not respond to an interview request, but in a written statement, a spokesperson says the VHCA represents a wide range of providers, including nonprofit and government-owned nursing homes, and has been working on a common sense and achievable staffing standard supported with adequate Medicaid funding. The industry has long maintained that Medicaid rates are too low to fully cover the cost of care.
I do know that that has been kind of like a spoke in the wheel for a lot of the providers.
I've heard the concerns expressed about the cost But I think sometimes we fail to look at where the money is going when we don't have enough staff.
March says for the sake of professionals like herself and the patients they serve, something must change.
You know, why is it important for you to speak out?
Because I want to make a difference. I'm sad, I'm tired of hearing it. These are human lives.
I'm Tyler Lane for CBS 6 News.